Thank you. Two more coronavirus deaths are reported in Bexar County tonight, and there are 56 new cases. Mayor Ron Nirenberg says the low case count is because Metro Health is moving to a new system and because cases tend to be lower on Mondays following the weekend. But tonight there is confusion over the true number of coronavirus cases as well as the death toll in Bexar County. Eyewitness News reporter Holly Stouffer asked local leaders to clear things up.
Metro Health is moving over to a more advanced case management system. As cases are double-checked manually, they're finding duplicates, 619 of them. On Sunday, those were removed from the total case count for Bexar County.
And this could happen when one person gets tested multiple times at various locations.
Chief of Epidemiology, Dr. Anita Curian, says moving forward, duplicates shouldn't be a problem.
We are excited to go into this new system that has much more rigorous algorithms to identify duplicates for us.
Mayor Ron Nirenberg says these periodic corrections shouldn't take away from Metro Health's precision at tracking trends in our community.
You know, some of these corrections that we've been making account to roughly 1% of the data. Trends remain the same, which is that we have an extreme number of cases in this community. It's spreading, and a lot of people have died.
Another point of confusion is the death toll in Bexar County. According to the state's data, 622 people have died from the virus in the county. But according to Metro Health, that number is 370.
Our recommendation is always to go by the data that's reported by the locals.
Dr. Curian says state officials get their number from death certificates. Then they pass that information down to local leaders who look into the death.
We do spend some time verifying that this indeed is a COVID-related fatality. So that time also factors into that delay in reporting.
Holly Stouffer, KENS 5 Eyewitness News.
There were 16 new coronavirus deaths reported yesterday, but 13 of them were from July. Dr. Curian says that sometimes happens when hospitals don't report deaths to Metro Health on the day they happen. And once a death is reported, Metro Health spends time verifying that it's related to the coronavirus. We know the numbers are complicated, and that's why we have the coronavirus tracker on the KENS 5 app and at KENS5.com. We update it throughout the day to put the numbers into perspective for you.